Hey everybody, this is Professor Beth RN with nursing.com, and today I'm here to introduce you to the PN NCLEX test plan. LPNs are such an important part of the healthcare system. When I was a new grad RN, I was trained by an LPN of 15 years, and she could run circles around me. I'm so happy that you're here, and I want to welcome you to the nursing.com family. We're here to put your mind at ease. We have your back. We're going to help you break down this test. All right, let's do this. Let's talk about your test plan structure. So your LPN NCLEX is broken down a few different ways, and I'd like to highlight the major framework so that when we break these down, these words will be familiar to you and help reduce your anxiety. Knowing is half the battle. So the content of the NCLEX is basically put into four major client categories and their client needs. And so there are 4 categories, 6 subcategories. I find this super confusing, but I have your back and I made it a lot clearer for you in the next slide. There's some integrated processes, and these processes are fundamental to the practice of an LPN, and you'll see them through every test question type. Fortunately, you'll see that you're probably very familiar with 5 of these already. Clinical judgment. Okay, this is basically the nursing process, but through a finer lens and a different vocabulary. And we're going to get to know these words so you can decode any NCLEX question. Now, I should probably talk about time, right? That's huge. So you'll have 5 hours, and that's going to include all of your breaks. And in that 5 hours, since it's an adaptive test, you can have a minimum of 85 questions up to 150 questions. Now, if you are unfamiliar with the nature of an adaptive test, that would take a whole nother lesson, but I can tell you exactly where to go to find out about it, to the National Council of State Boards of Nursing, or you could just put the NCSBN right in your browser and it'll pop up and look for your test plan. Client needs. So I mentioned earlier, there are a few categories and subcategories of client needs, and I find that a tad confusing. So I broke this down to you in 8 categories. Now, if you are a visual learner, you're going to already notice that the largest category is up here in the right, and this is known as coordinated care. Now, if you follow this picture clockwise, then what you're going to see from here, you'll be able to understand the largest chunks of your test versus question content. Why is that so important? Well, it's important to know, one, you need to know your own strengths and areas to grow for this test, correct? But also, you want to know where the biggest chunks of these questions are in the NCLEX. And I could see right now that coordinated care, pharm, and safety and infection control are about 50% of my test. So I know I could focus on these questions. Now, if pharm scares you, that's normal. And just know that this is more than just surrounding giving medication. This is all of your rules attached to giving it. You need to grow in pharm, no biggie. We have a course ready for you at nursing.com. So let's break this down just a tad more. And what I did was I listed these in order of the biggest chunk of your test. So coordinated care, that's going to be about 21%. And this is going to represent you working with other healthcare team members. So that whole interdisciplinary staff. So you're thinking respiratory therapy, you're thinking of PT, OT, ST, or maybe even a chaplain. So this is all interdisciplinary work right here. Pharmacological therapies, again, you don't just administer medications, you have to have a spectrum of skills. And it's 13% of your test. This can be dosage calc. This could be blood transfusion. This could be even labs that you're going to monitor with medications. Safety and infection control. This is going to be about 13% of your test, and it's going to involve protecting yourself, but also protecting the patient from environmental hazards. So you're thinking about what? Patient identifiers before you give a med, all the way to, is there an internal disaster like a fire? Of course, PPE, right? PPE and isolation. You're going to see that too. Physiological integrity, this is 12%. This is going to be the well-being of your patient's family, all the way to maybe something like identifying a patient that has a substance abuse disorder. Reduction of risk. This is 12% of your test. This is going to deal with complications, and you're going to be looking for those complications, whether it is from a treatment, a procedure, or even maybe the patient has a comorbidity, right? So they're there with heart failure, but they have diabetes. This can be as simple as taking a patient's vital signs all the way to maybe even placing a central line. Physiological adaptation. This is about 10% of your test. And this is going to have to do with patients that have a presentation of chronic, acute, or even life-threatening conditions. So you're going to have to do those acute skills. So you're thinking what? Tele strips. Maybe you have to work with chest tubes. Maybe even you have a patient in respiratory distress. Basic care and comfort. This is 10% of your test. And this is just assisting patients in ADLs. So this could be something like irrigating a Foley. So the patient can void. So you're thinking like elimination, mobility, skin integrity, that basic care and comfort. And then finally, health promotion. Health promotion is 8% of your test. This is going to be care of all populations, all the way from newborns, toddlers, adults, all the way to the frail elderly. And this could include also prevention of high-risk behavior like substance abuse or smoking. So if you're weaker in peds or maternal, no, it is about 8% of your test. So that's comforting. Integrated process. So I don't even really need to read most of these off to you because you already do these naturally. You're going to be a nurse. You're a caring individual. You're going to give support and compassion. The clinical problem solving, that's the nursing process. So you've heard this semester by semester by now, right? Collecting data, planning, implementing, evaluating. Communication, we already talked about. You're going to have to talk to all these interdisciplinary folks throughout all of these questions, and you're going to have to document that. Cultural and spirituality, you're going to have patients from different cultures, whether it's a family culture or geographical. You're going to have people with different spiritual needs, right? Like Jehovah's Witness may not want a blood transfusion. You've probably seen these questions repeatedly. And then teaching and learning, we know that we facilitate our patients, their knowledge, their skills, and even their attitude of promoting those changes in behavior so they don't keep coming back to the hospital. But this is the big one, guys. Clinical judgment. This is where most students need a little help, and that's what I'm here for. Let's take a deeper peek at this one on the next slide. So clinical judgment takes the nursing process and it basically is going to divide that into smaller steps. So it's going to measure your knowledge to observe, assess, prioritize your concerns, and then come up with solutions. Boil that down. Will you be a safe nurse? That's what it is going to measure. And it's measured by next-gen NCLEX questions. Now, these can be presented as a case study or an individual standalone item is what they call, meaning not attached to a case study. No matter how many questions you take, whether you take 85 questions or up to 150 in those 5 hours, you will have a minimum of 3 unfolding case studies. And each one of those case studies will have 6 different questions that are going to relate to the case study and that patient. So you're going to watch that patient as their presentation unfolds. The other 10% of your questions are going to be standalone, meaning not attached to a case study. Those particular questions, you can tackle those on nursing.com. On our YouTube channel, we have tons of those where we can break those down to you for free. So come see us on YouTube for these, and I will break them down for you. Knowing how to decode this new vocabulary will get you a long way in understanding what the question is asking you. And nursing.com has some great cheat sheets to download, including this guy right here. All you have to do is search NCJMM, so the Nursing Clinical Judgment Measurement Model. And you can check out this guy. What is recognizing cues? What is analyzing cues? You can find all that information out, and it will help you decode. Okay, guys, so just to summarize your LPN NCLEX and how to be successful on this, know that you are going to have a max of 5 hours to take your test. Within those 5 hours, you're going to have a minimum of 85 questions up to 150 questions. Remember that if you don't quite understand adaptive testing, just put in NCLEX-PN in your browser. It will take you to the National Council of State Boards of Nursing. Now, remember, under those 8 categories of client needs, coordination of care, pharmacology and parenteral therapies, and physiological adaptation make up about 50% of your test. So make sure you know not only where you need to grow and where your weak areas may be, but also where to spend the most chunk of your time studying. Integrated process, you know most of these processes. You already care. You've already learned how to document. And of course, you're growing in that skill. But clinical judgment is going to be the most challenging. For clinical judgment, you're going to have a minimum of 3 case studies and at least 10% standalone questions. Make sure that you know the verbiage so you can decode what these questions are asking you so you're successful. Just come see us at nursing.com. We have great cheat sheets. That was a ton of information, but we made it through, guys. I know taking your NCLEX can be stressful, but it's important to know that you have our support. LPNs just add another layer of skill to the patient care team, and our patients truly benefit from you being there for them. Whether you visit us on YouTube, the nursing.com website, we have a ton of tricks up our sleeves to guide you to success. So take care, everybody. And as always, happy nursing.